an ache or a pain that may need medical attention? Well, for many, the answer is yes, but they have been putting things off to avoid the hospital. And over time, it can lead to more pain and trouble. And there are many treatment options to consider. And we are joined by Dr. William Higginbotham with our sponsor, the Core Institute, to get answers to your questions. Thank you for joining us, Doctor.
Thank you for having me this morning, Tati.
It is our pleasure. Well, many people need a joint replacement procedure, perhaps a knee or a hip, and have been delaying it. What do you suggest for these people?
Well, I suggest that they don't delay it. When you delay these kinds of procedures, you're more inactive. We've all been sitting for a long period of time, and it can increase your problems and difficulties. And we've taken a lot of steps these days to make it much safer for people to proceed with the things that they want to proceed with.
Okay, and I think that a lot of people, may have concerns, but here's another concern. Are there risks in delaying these procedures?
There are risks in delaying the procedures because what happens is people are inactive for longer periods of time. They're unable to do their normal activities of daily living. They can't go to church. They can't visit their grandchildren. They can't travel. They can't do the kinds of things that we've all been looking forward to doing. And sitting for longer periods of time can make them stiffer. It has cardiovascular implant possibilities. It can have cardiovascular problems. So people have more difficulties by sitting and being more inactive.
Okay, great information. Now, here's another thing. Do all joint replacement procedures need to be performed in a hospital?
So not all the time. We have outpatient centers now, and patients that are not sick or don't have any major health problems can oftentimes have their surgery in a place where they can do it and go home on the very same day. So you don't have to have the experience of being in a hospital where there are other patients that may have other illnesses in that hospital.
All right. Now, if someone is still just not ready to have joint replacement, what are some of the things that they can do in the meantime to help alleviate pain?
Well, I would suggest that they talk to the orthopedic surgeon first of all. There are a number of different things that can be done to mitigate some of the symptoms until the patients are ready to make their decision. So they may have some injections that we can do that sometimes will make them feel more comfortable until they're ready to make that decisions. Sometimes physical therapy and home exercise program, things as simple as riding an exercise bicycle or utilizing an elliptical machine will make them stronger and more flexible. Stronger and more flexible joints generally have less symptoms than ones that are stiffer and weaker. So these are some of the things that they can do. We also have specialized pain doctors that can sometimes do blocks and injections to help make them feel more comfortable until they're ready to make a decision.
All right, Doctor, so much good information. Thank you so much for joining us this morning.
I appreciate it, and thank you very much for the opportunity to talk about these important things.
It is our pleasure. To learn more about the Core Institute and how they may be able to help you, visit their website, thecoreinstitute.com. Again, the website is thecoreinstitute.com. Jason?